One of the greatest fears that seniors have when it comes to retirement is making some type of mistake about their Medicare. Now, by the way, that's a legitimate fear because Medicare mistakes are very common. They're also very costly and can even affect the type and quality of the healthcare services that you receive. So in this video series, I'm going to teach you everything that you need to know about Medicare Parts A, B, C, and D so that you can lay aside all your fears and be confident in the choices that you make about Medicare. All right, just before we dive into the details of Medicare Part B, let's do just a quick review about the parts of today's Medicare. Medicare, of course, has changed through the years. And so Part A is part of the original Medicare. And this is pretty much everything that's going to be inpatient type services. So this would be if someone goes to the hospital or has a skilled nursing stay, for rehab. That's Part A. And then Part B is pretty much everything outpatient related. But not only outpatient related, what's really important to note about this would be all doctor services, primary care doctors, specialists, a surgeon, anesthesiologist, ER doctors, hospitalists, all the doctors are going to be paid through Medicare Part B. Now, Part A pays for the facilities where you are, skilled nursing or hospital, but B is going to pay for the doctor services. So this is everything outpatient. This would be maybe a knee replacement or an MRI, CAT scan, PET scan. Part B also is going to pay for durable medical equipment. That's medical equipment, of course, that can be reused. Usually a life expectancy of that equipment 3 years or more. Multiple people can use it. Beds in the home, wheelchairs, walkers, those kinds of things. Part B also covers all your preventive services. And also want to note that Part A and Part B cover medications. Medications that are professionally administered in the hospital or an outpatient basis. Medications that we self-administer are going to be covered by Part D. But up here, I always like to point out that they also do cover meds, but again, only those that are professionally administered. And now Part C plans, these actually began just right around 2003. These are called Advantage plans. And so what happens with these plans, we enroll in an Advantage plan, we have to enroll in Parts A and B, but instead of A and B now directing our care and managing our care, now we have a private health insurance company that's doing that for us. And the majority of people then that have an Advantage plan are going to have a Part D plan embedded. So we actually can get an Advantage plan that includes a Part D plan. Now, someone that doesn't have an Advantage plan, then they can buy what we call a standalone Part D plan. This system began in 2006, and what I'm trying to teach you is this would just simply be all of our self-administered medications. Your cholesterol, your blood pressure, maybe insulin, those kinds of things you take are going to be covered by Part D. Meds that are professionally administered, A and B will cover those. All right, so again, that's the parts of Medicare today. All right, next let's look at the eligibility for Medicare. And as you watched probably my last video with all parts about Part A and all the details that you knew that Part A, we are actually eligible based upon 40 quarters. All of us, when we work, we're paying into Social Security taxes and Medicare taxes. That'd be FICA taxes or self-employment taxes. But as long as we have 40 quarters, 10 years worth of work, we get 4 quarters per year. Then we have accumulated 10 years worth of work, then we can get Medicare Part A at zero cost. Sometimes people don't have their own 40 quarters, so they get those from a spouse or an ex-spouse. There's some rules to be able to draw from someone else's work record. But the point is, we're always looking for 40 quarters. Now, when it comes to Part B, it has nothing to do with 40 quarters whatsoever. Okay, Part B is going to be based upon your income. All right, and we'll talk about this here in a few minutes, but we actually pay a premium for our Part B, and that's what makes us eligible. We have to pay for that, all right? And so A and B are different in that regard. I just want to make sure you're clear on that. All right, that then brings us to the enrollment options as far as when we're going to start Medicare. What are those options that are available to us? So let's go through these together because there's actually 4 of them. The first one is Part A and Part B can be delayed, meaning you don't have to do anything with Medicare at 65 as long as this applies. You or your spouse are still working and planning to continue to work, and you're covered by an employer-provided plan that has 20 employees on the payroll or more. So if that's you or your spouse covered by that plan, 20 or more, then you actually can delay Part A and Part B. You don't have to take either one of those, all right? Now, I know sometimes people hear that they have to take Part A. If they don't, they're going to be penalized, and that's not true. Remember this. As long as you have 40 quarters paid in, or your spouse or ex-spouse does, so you're drawing those 40 quarters, you'll never have to pay a premium for Part A. It'll always be zero for the rest of your life. Therefore, there's never a penalty applied as long as Part A is premium free, which is 99% of the Medicare population, all right? And so the whole point is you can delay both A and B. Now, the reason I would do that if you're still working or your spouse is, and there's 20 employees or more, and you have an HSA, and by the way, I'm shooting this video today is June the 20th, and so as it stands today, because there's some legislation that we're waiting to hear back on, but as it stands today, if someone would like to continue to contribute to an HSA, they can't enroll in Part A or B. Okay. Now those rules may change with this new legislation, but my point is anyone that has an HSA should not presently take A or B because then they cannot contribute to the HSA. But the whole key is 20 or more employees. So that's one option. Let's talk about the second option, and that would be to do Part A only. And again, as it sits right now, I would recommend people doing this unless they have an HSA. I would delay it. And again, part of this new legislation that's being proposed right now, it's passed the House, the Senate is looking at it right now. They're actually going to change this. They're proposing that the law passes that you would be able to have A only as long as you're covered by a high deductible health plan, you could then contribute to an HSA. We hope that's going to pass. But as it sits, people that don't have an HSA, it's certainly fine to do A only. Now, what happens if you are still working, again, we have 20 or more, then and you have A only, your company plan is going to be the first payer, and then your Medicare Part A would be the second payer. And in the second payer position, they don't pay copays, they don't pay deductibles, but they will pay coinsurance. And so if you had a hospital claim, you had some coinsurance responsibility, then Medicare could help with that. All right, next option would be to do Part B only. Now, folks, I've been in this business 16 years, and I've never seen someone do this, but I know technically you could. Well, why would someone do it? Well, let's say that someone didn't have 40 quarters, and so in order for them to have Part A, they have to buy it. And there's people that have to do this. Right now, if someone has 0 to 29 quarters, they're paying $515 a month for their Part A. 30 to 39 quarters, they're paying $285 a month. And so if someone doesn't have that money, and they don't have 40 quarters, and they're not going to go back to work to try to get them, they may not take A, but they could take B. Now, listen, if you have B only, you can't get a supplemental plan, you can't get an Advantage plan. So again, this is going to be pretty rare, but at least in the context of our video today, I do want to make sure that that is possible. Most people, again, A is going to be free, so they're going to take it. But if they had to buy it, they actually could just do B only. Again, I've never done it once in my whole career. All right, so then let's talk about Parts A and B. This is going to be the norm here. We can take Part A and B at 65, or we can take it after. All right? And so I'm going to teach you more about that here in just a minute, but I want to make sure you're clear as we look at our options, we're going to fit within one of these four. All right, we're going to get into Medicare enrollment. I'm going to explain the process and paperwork, but just before I do, I know there's a lot of people that enjoy staying up to date on Medicare, what's happening, and that really is one of the purpose of our channel. And so if you want to stay up to date, it's very easy to be a subscriber. There's, of course, no cost for that. And then every time that we put out a new video, you're notified. And so we love to hear from you as well. So if you have a comment, give us the thumbs up. That helps us push that video out to other people as well. But we'd love to have you subscribe to our channel and continue to learn. All right, so let's talk about then the enrollment paperwork and processes. This is going to be different. So first off, if we take A and B at 65, which is a lot of people are going to do this, we call this the initial enrollment period. And what I want to teach you about this as it relates to our topic, everything about B, is that if we come in at 65, if you're on Social Security, what happens? Meaning you're taking your retirement benefit, could be spousal, could be survivor, widow, or widow benefit, and you're turning 65 and you're on Social Security, then your Medicare card A and B is going to show up about 100 days prior to your birth month. About 3.5 months, card shows up. But if I'm going to start Medicare at 65 and I'm not on Social Security, we have to self-enroll. And why this matters for those of you that are going to have to self-enroll is this. You only have 7 months to self-enroll at 65. And so let's say my birthday is this month. I'm shooting this video today. It's June the 20th. And so let's say I turn 65 during the month of June, and that'd be 2025. What happens is 3 months before, and the month of, and then 3 months after, I'm in what we call this initial enrollment period. And so my birthday's in June, I could enroll in May, I can enroll in April, I can enroll in March. And if I enroll during these 3 months, my Medicare is going to start June 1, 2025. If I enroll in June, what's going to happen, they're going to put my coverage off for a month. I'll start in July. If I enroll in July with a June birthday, they're going to start me in August. If I enroll in August, they're going to start me in September. Then the last of my 7th month, I can still enroll, and they're going to start me down here in 10/1/2025. And I certainly won't want to do anything later than that, because after that, I've made a mistake, and I'm going to have penalties. I'm going to have problems with a different enrollment period. But what I'm trying to teach you is we have this 7-month window, and those 7 months are 3 months before you turn 65, the month you turn 65, and 3 months after to enroll into Medicare at 65. And when you enroll will determine when they're going to start your coverage. Now keep this in mind. If you were born June 1, then this whole thing moves back a month. If I'm born on the first day of the month, my Medicare goes effective the month prior. So in this case, if it's June 1, I'd start my coverage in May, 3 months before, month of May, and then 3 months after. So I want to always remind people, your birthday's on the 1st, your timeline is going to be a little bit different. All right, so that was Medicare starting at 65. Now let's talk about those of you who are going to start Medicare after 65. And what's interesting, this is about half of the population starts Medicare after 65. Now we have a different enrollment period. We call this the special enrollment period. And what's involved with this is actually different paperwork, because the process at 65 is very simple. You have 40 quarters, you can enroll online, very simple to do so. But when we're coming in after 65, it's different. So let me just make this up. Let's just say that we're going to start Medicare at age 67. And so what we have to do is now, in order to qualify for a special enrollment period, we have to verify that you have had credible coverage, meaning active employment, insurance at work, could be you or your spouse's, doesn't matter, all the way back to 65 with no months missing. And COBRA is not considered credible, folks, okay? It has to be active employment insurance back to 65. And the way that we verify this is a form we call an L564. And this is a form, if you work with us, we'll do all this for you. But if you're doing it, you have to fill out Section A, which is all about your employer and you, your Social Security number and their name and address. And then it goes to the HR department for them to fill out the next section, verifying insurance and employment and all that, and then they sign it and they get that form back to you. So that's called the L564. Now, if I'm coming in at 65, I don't need that form. I just need 40 quarters. And I can do everything online. But now I'm going to have to verify credible coverage back to 65 with, again, no gaps. The second form I'm going to use is what is called a 40B form, 40B. And this is a very simple document. Your employer doesn't fill it out. You do, or we'll do it for you. But the purpose of this is to choose the date we want to start. So let's say I'm over here and I'm 67 and my coverage is going to end June the 30th. And I want to start my Medicare July 1. I'm going to start this whole process here about 60 to 90 days before July 1. And to get the paperwork filled out by the employer, we have this other form, 40B, and we're going to submit it to the Social Security office. And the purpose of that form is to tell them when we want to start. So I would put on the form my name, my Social Security number, and I'd say, please begin my Medicare July 1 of 2025. So you actually pick the date. Our initial enrollment period, when we enroll, determined when we start. If it's a special enrollment period, we're going to pick the date and tell them when we want to begin. So once that employer plan is over, we're going to tell them now we're ready to start our Medicare. All right, so those two papers are involved during the special enrollment period if we want to come in with no penalties and no problems. All right, that brings us now to the actual health care services that are going to be covered specifically by Part B. So let's go through these together. First off, everything that's going to be outpatient is going to be on the B side of Medicare. So again, this is going to be your MRIs, your PET scans, CAT scans, your lab work, all the doctors that you see or they come to see you in the hospital, the specialists you see, outpatient surgery, you have a knee replacement, those kinds of things, ambulance services, ER visits, all that is going to be covered under the Part B of Medicare. Again, all doctor services. This would be your primary care doctors, any of your specialists that you're going to see, again, are going to be covered by Medicare Part B, all right? And then anything that's going to be what we consider to be durable medical equipment. covered by Part B. So this is CPAP machines and oxygen equipment and nebulizers, diabetic supplies, scooters, wheelchairs, walkers, all those things are going to be covered under Medicare Part B. In addition to that, we also have home health care. So this is someone more than likely that had an outpatient surgery, maybe a knee replacement, and they go home, and the home health care agency comes to the home to do the rehab visits, and again, that's going to be covered under Medicare Part B. In addition to this, we also, as I mentioned earlier, we do have medications covered under Part B. These are professionally administered meds that you have pain medication during an outpatient surgery, anesthesia, those kinds of things covered by Part B. If someone is an insulin-dependent diabetic and they use an insulin pump, the Part B covers the pump, but also covers the insulin that's going through the pump. Sometimes we'll have ladies that have bone density issues. It usually starts off with the osteopenia. They take some normal, very low-cost oral meds, but if it progresses into osteoporosis, very common today would be Prolia. It's a very expensive shot. We take 2 of those a year, every 6 months, and that Prolia is not self-administered. It's administered in a doc's office, a physician's office, therefore covered by Medicare Part B. Chemotherapy would be the same way, covered by Medicare Part B. And then lastly, preventive services. Preventive. So if someone goes in for an annual wellness exam, or they go in for a screening, maybe an immunization, vaccination, those kind of things are all considered to be preventive. And keep this in mind, preventive is the only thing that Medicare covers 100%. All these other things that we get, we're going to have some type of responsibility. All right, so that's what's covered now by Medicare Part B. All right, so we've seen the enrollment, we've seen now the services covered. Let's talk about the actual cost of being on Medicare Part B. So first off, I want you to notice this. For most people today, when it comes to Part B premium, they're going to pay $185. Now keep in mind, I'm shooting this video June 20th, 2025. So if you're watching this in 2026 or beyond, that number's not going to be right. But it's $185 a month, and if you're on Social Security, it comes right out of your check. If you're not on Social Security, you can actually set up a monthly bank draft with Medicare. That's called Medicare Easy Pay, or some kind of an online payment system, or you can actually have them send you a bill, which would be on a quarterly basis. By the way, if you decide to do a direct bill, your first bill, very first one, could be 2 months, 3 months, 4 months, or 5 months. It depends. Kind of like the lottery. When you enroll into Medicare, one person gets a 2 month, one gets a 3, one gets a 4, one gets a 5. They just kind of rotate through. And so you never know, but that first bill could be 2 to 5 months. After that, then it would be every 3 months. All right, so if you want to pay monthly, it comes out of Social Security, or you can set up, again, a monthly bank draft with them. So that's what most people pay. Now, you're going to notice over here, but some people pay more. And so this would be people that are considered to be high income by Medicare standards. And what's happening with them is they're going to pay an additional amount. We use the acronym for this additional amount as an IRMA. It stands for Income Related Monthly Adjustment Amount. It's a surcharge added to Medicare B as well as Part D plans. So the question is, who has the IRMAs? Well, IRMAs are just really based upon your income. So what Medicare does every year is they set thresholds. And just for simplicity, I'm just going to talk about 2 thresholds now. There's actually another one, but let's talk about single and then married that files a joint return. Okay, so if you're married and you file a separate return, again, you have a different schedule of IRMAs, but these are the most 2 common ones. So we have a threshold income, and that income is $106,000 and $212,000 for a married filing a joint account. And so what we're looking at for this income is actually called the modified adjusted gross income. And that modified adjusted gross income is line 11, which is your AGI, plus line 2A, which is tax-exempt interest, municipal bonds, some savings bonds. And they put those 2 together, and that's your income that Medicare uses. Now remember, they always look back 2 years. So if I'm on Medicare in 2025, they're looking at my modified adjusted gross income in 2023. Next year, we roll in 2026, they're going to look at modified adjusted gross income in 2024, always looking back 2 years. And so we have the thresholds: single, married, filing a joint. So if I make $106,000 or less, then I'm going to pay the base premium established by Medicare. This year, $185. If I'm married filing a joint, if we make $212,000 or less, each of us then would pay the $185. But again, if I'm going to be above these numbers, now I'm going to have these IRMAs. Okay, I'm going to have the surcharges. And again, there's 5 different levels of IRMAs. We have 5 levels. I'm not going to go into all those here during this video. It just takes too long. We have 5 levels. And kind of on the low side, we're in the range of about $85 a month for B and D IRMA. And on the high side, it's pushing about $500 a month, okay? And again, the $500, you're over here making, you know, probably $750,000 a year. So most people aren't this high, but the point is they have these IRMAs that are added to the base premium. So some people that are high income are going to pay more. And if we have an IRMA on the B, we're going to also have an IRMA on the drug plan as well. Those aren't very sizable. They range anywhere from $15 to maybe $70 a month. All right, so just want to make sure that you know we are going to pay a premium for a Medicare B. Now, if you're qualified for 100% coverage with Medicaid, then the state oftentimes will pay that for you. But if you're not on Medicaid, you're going to pay a premium, and these premiums adjust. They normally go up a little bit on an annual basis, as well as these thresholds as well. So if we stay below the threshold, we pay the base premium. We're above that, we could have an additional surcharge called IRMA. All right, that brings us then to the penalties, because there could be some penalties with Part B. Now let's walk through this. So if I come into Medicare during my initial enrollment period at 65, and I enroll during that IEP period, I have a 0 penalty. Okay, you do it during that 7-month window, no penalty whatsoever. 3 months before, month of 65th birthday, 3 months after, no penalties. In SEP, this means I came in after 65, right? And so what happens is, from the date I lost my employment, I actually have 8 months to come into Medicare, and I'll still have no penalties. Now, from a practical standpoint, you're not going to use that 8 months. It's there in case you make a mistake. Most people, once my employment coverage ends, I'm going to start my Medicare immediately. Okay, but we still have 8 months if we were to make a mistake. So we come in after 65. We've lost employer coverage. We ought to set up our A and B and all of our coverage prior to that coverage terminating. But if I made a mistake, I still have 8 more months, because that's how long the SEP lasts. So as long as I've enrolled in a Medicare A and B within that period, again, we have 0 penalty. All right, now what happens? We have another enrollment period called the general enrollment period. And this is someone who has made a mistake. Okay? They missed this for whatever reason. Maybe they didn't have one of these, or they missed this for, they went beyond the 8 months, and now they have to come into general enrollment period. They're eligible for Medicare because they have 40 quarters. But what happens with the GP, there's 2 problems. Number 1 problem is this. We can only enroll the first quarter of the year, okay? Which means January 1 to March 31, we can enroll in a Medicare. So if I enroll in a Medicare in January, they'll start me February. Enroll in February, they'll start me March. March, they'll start me April. But let's say I don't enroll here and I find out I made a mistake, and now it's April or May or June or something, and now I just missed it. So now I'm gonna have to wait till the next year and then enroll in January for February start date. And so when this happens, now we could be subject to penalty. So here's what I'm trying to teach you. If you use a GEP, that's only open for Medicare enrollment during those first 3 months. And when you start, then they'll start you the next month. So we don't want to miss those 3 months. Then in addition to that, what happens for every full 12 months that we go without Medicare when we should have had it, they actually add a 10% penalty to our Part B premium for life. So someone right now has a 10% penalty. The premium is $185. They got $18.50 penalty. We got 3 and 1, 892. So now instead of paying $185, they're going to pay $203, and then that $18.50 penalty will be attached to their premium all year long. That number goes up, then again they got a 10% penalty. That 10% penalty is for life. And though we have the GEP available, we don't want to use that one. We want to use one of these 2 to avoid that Part B penalty cost. All right, so we're clear on what it costs to have Part B. Now let's talk about the additional cost, which is going to be our out-of-pocket expenses. All right, now if you watched my other video on Part A, you've seen a very similar chart. When we talk about out-of-pocket expenses, we are talking about gaps, meaning when we get a service beyond preventive, there's going to be some type of liability I have, some financial responsibility. Medicare pays, but they don't pay 100%, so the gap is my responsibility. And so just like we had 3 gaps on the A of Medicare, now we have 3 gaps on the B of Medicare. So let's go through those real quickly. So again, it's 2025, and the Part B deductible this year is $257, and that is annual. You may recall Part A, that deductible can happen multiple times in a year. This cannot. It's once a calendar year. So if you start your Medicare July 1, that's your deductible for this year. You start your Medicare December 1, that's your deductible for this year. They do not prorate it. It's an annual deductible, and then that number is going to reset every January. Last year in 2024, that read $240. So they bumped it up $17 for 2025. So it usually goes up a little bit on an annual basis. So again, it's a calendar year deductible once a year. So the first $257 coming through Part B, that's going to be out of my pocket. If your first claim was an MRI, it'll cost you $257. If your first claim was a doctor visit, it may be $85. But we got to get to $257. And once we reach that deductible, then Medicare turns into what we call an 80-20 plan. Medicare is going to pay 80%. You have to pay coinsurance, which is 20% of the bill. Remember, Medicare doesn't pay for anything 100%. So everything going to the B system will be, your responsibility will be 20%. This actually is the greatest risk that you have, because if you had a serious health issue, you had an operation, the surgeon, you got to pay 20%, the anesthesiologist 20%, the attending physician 20%, all the follow-up visits 20%. And so you can see that coinsurance can be quite expensive. And then the last gap is called an excess charge or excess charges. Now what this is this is a doctor that adds 15% to the bill. Okay, I'm going to teach you something about docs. First off, we have what we call participating doctors, participating physicians. And this is a doctor that is under a contract with Medicare, and they participate in what we call the fee-for-service schedule. So that doctor may get $80 for a doctor visit. That's the fee-for-service that Medicare has determined. And so a participating physician is going to take that $80, $85 doc visit as payment in full, not going to add anything at all to the bill. And so 95% of all doctors are participating. We also call this, they take assignment. They'll take that amount that Medicare has said they'll pay for that particular service. And again, of that bill, Medicare is going to pay 80%. You'd be responsible for 20%. But again, they're not going to add to the bill. Okay, and that's most common. Now we have also then non-participating physicians. So they are able to bill Medicare patients, see Medicare patients and all that, but they're not under the contract to take that Medicare approved amount as payment in full. They add to the bill. What do they add? They add that 15% called excess. Now again, this doesn't happen often. Somewhere between 3 to 5% of doctors do it. It happens, but not real common. But when it does happen, you're responsible to pay that. Okay, and then we have some docs that actually opt out totally. Now, 99% of all doctors take Medicare. The 1% that don't typically are going to be psychiatrists. About half of them do not. And so my point is, if you're seeing a doctor that's non-pediatric, 99% of them are going to take Medicare, okay? But they'll be in the relationship one of here. If you have a concierge doc, they've opted out as well, and they don't take Medicare. All right, so those are the gaps. So we have our deductible, 20% coinsurance, and excess occasionally. So with these gaps, the majority of people are not interested in that kind of liability, especially that 20% coinsurance that never goes away. And if we're hospitalized multiple times in a year, we got to pay that deductible more than once. So most people don't want the liability, so they're going to go and purchase what we call a Medigap policy, also called Medicare supplemental policies. And these supplemental policies, that whole system was designed and by Medicare. So Medicare sets the rules for Medicare supplemental plans, and they've come up with this letter system. And so they decide, meaning Medicare, decide what plans they're going to pay and what they're not going to pay. And so there's 10 different supplemental plans on the market today. Now you'll see in red here, we have the C and the F plan. Those two plans were actually now they're grandfathered in if you had one, but anyone that actually starts Medicare 1/1/2020 after cannot get a C or an F plan. Those are not options. So anyone that started Medicare before 1/1/2020, those would still be options. It's very difficult to even find a C, but there's still companies that will write F plans. But again, you're not eligible for that if you're starting Medicare after 1/1/2020, which most of you watching this would. Okay, so then what we're going to look at then are these supplemental plans, and right now the two top plans are the G plan and the N plan. So what I'm trying to teach you is what we're doing with these plans. We take the gaps and we can transfer the liability of some of these gaps to the insurance company, and we pay them a premium to take that liability from us, so we don't have to be out of pocket. And so let's look at the details of those plans. All right, so there are the gaps, the 3 gaps on the B side. And so what we're going to look at first would be if someone did have an F plan. Remember, had to start Medicare before 1/1/2020. It still happens. In fact, I wrote 2 F plans last week, so people are still buying these. And so what would happen with the F plan? Well, that F plan would fill in all the gaps. Now, if you watch my video on Part A, it also filled all the gaps in there as well. So which truly means if someone has an F plan, it is a full coverage plan. As long as they're seeing a Medicare provider, and as long as Medicare the service they're getting is approved and covered by Medicare, then they should never get a bill. And that's why, frankly, Medicare got rid of these, because they were full coverage. They didn't want full coverage plans anymore. They wanted people to be out of pocket for some other things beyond just paying a premium, because there was a lot of overuse of F plans. But the point is, Medicare F plans truly are 100% coverage. All right, that brings us to what would be the most popular plan today, and that is actually the G plan. And so the way the G plan is going to work is this. The G plan will not pay that for you. You have to pay that once a year, the $257. It will cover the entire 20% coinsurance, and if you ever went to a doctor that charged excess, that's going to be covered. Now, the G plan, like the F plan on the A of Medicare, covers everything. So go to the hospital, go to skilled nursing, doesn't cost you anything. And on this side, just that, you have to meet once a year. So the first 257 bills going through B would end up coming to your mailbox. But after that, again, we have full coverage. And then that brings us to the last one, which would be the N plan. This is a very popular plan, just a little bit right behind the G plan in popularity. And the way the N plan is going to work is this. You're responsible for the B deductible, just like the G. F covered it, but nothing else was going to. And if you have excess charge, then you're responsible for that as well if you had an N plan. F covered it, G covered it, but N does not. And again, it doesn't happen often. It's very rare, somewhere between 3 to 5% of the time it happens. But you would have the full 20% coinsurance covered. However, what happens, we also have with the N plan, is every time we see a doctor, primary care doctor or specialist, or we went to some other professional provider, we are responsible for a copay up to $20. 20% coinsurance is covered, but I'm going to have to pay a $20 copay. And if I go to the emergency room, I've got a $50 copay for that. All right, and so taking on a little bit more exposure, a little risk here. It doesn't happen often, but the reason some people today are going to go with an N plan versus a G is because an N plan is going to be, on average, about $40, sometimes $50 a month cheaper. And so they're going to save maybe $480 to $600 during the year. Don't take on a whole lot of risk with that. And then they have some copays. Others say, nah, that $40 or $50 a month is not going to make or break me. I'll go ahead and get the most comprehensive. And folks, both of these options are excellent. They're very, very good plans. I don't think you make a mistake. Now, some states, there's even a bigger difference than that 40 or 50. But you just have to decide based upon budget, if you're concerned about excess or not, copays or not. And if you're not, it may be a wonderful fit. If you're concerned about those things, then G would be a good fit as well. You just can pay a little bit more for that. But the beautiful thing about all MedSup plans is that when we have them, we can go to any doctor. As long as they take Medicare, they will take your supplemental plan. Secondly, what happens, we never have to do pre-authorizations. The insurance company follows Medicare. So if Medicare covers something and you're seeing a Medicare provider, your supplemental plan G or N is also going to follow. They can't deny services, they can't delay services whatsoever, and both of these plans are lifetime and portable, so they can never be canceled by the insurance company other than non-payment of premium. Pay your premium, it's yours for life. Move from one state to another, you take your supplemental plan with you as well. All right, so that would be the G and the N plan to get those gaps covered. All right, let's close it out with this last slide here. And that's what we call the supplemental plan quiz. We have literally tens of thousands of people, I have probably hundreds of thousands of people that take this quiz on an annual basis. But I encourage you, you can click the link in the description, take the quiz, and really see which one of these plans is going to be best for you. What would be your preference? So you answer a few questions about that, and it'll show you the results. And then if we can help in any way beyond this video or beyond this quiz, we'd be delighted to just reach out to us, and we'd be privileged, really, and honored to serve as your Medicare broker. Let us know if we can help. Thanks so much.